Hey guys, it's Hina here at Rebalance Physical Therapy and Wellness in Philadelphia, Pennsylvania. And today on Dang, That Sounds Like Me case histories, we're going to be talking about a female that is having significant lower abdominal ovary type pain to the point where she has to feel that she almost needs to go to the emergency room. So what is these Dang, That Sounds Like Me case histories? This is basically, where I talk about some of the histories of patients that I have recently consulted with or seen that I feel that their symptoms might be coming from a musculoskeletal issue. So to get started, there is a woman, she's about in her mid 40s. She's a really intelligent physician who was complaining of this ovary type pain, so in that lower abdominal area, that comes on kind of intermittently, that has come on intermittently, meaning it's episodic, okay? It's not there all the time. It's sometimes related to activity. Sometimes it might not be, but she has noted that it's related to activity, meaning the things that she does every day. She also thinks that it comes around certain times of the month. She's kind of going through this like weird kind of perimenopausal state. So she saw her gynecologist. Her gynecologist basically said, yeah, this could be related to some ovulation issues that you might be having. But since she was speaking with me, she decided, hey, you kind of work on this pelvic floor. You're a pelvic floor therapist. Like, can you help me out and tell me what you think this might be? And so anyway, so I asked her, I said, what have you been doing in the last month? And she's like, well, I've been working out a lot because I'm really trying to lose weight, especially because I'm going through this perimenopausal, I feel like I'm putting on weight. And so I've really been working out. I said, great. What have you been doing? She's like, well, I've been running a lot. I've been doing a lot of spinning. And so I think, that also may have been around the time where this pain started. And I said, all right, well, that makes sense that it could be possibly a muscle issue because it is correlated with working out. And when you're working out, you're using muscle. So, long story short, we started diving into, we kind of cleared out everything in terms of other things that it can be. Gynecologic issues, she's kind of seen her gynecologist, nothing major. So they think it's kind of related to this ovulation, but maybe not. They're not sure. She had, her family physician rule out anything abdominally that it could be. And so for me, since it was really, related to this time where she started working out, we started diving into more questions. Okay, well, what do you do all day? Are you sitting all day? Are you running around all day? Turns out she's very active during the day. But again, nothing significant, but she has been sitting more than normal. And so, make a long story short, her pain was getting so bad to the point where she had to go to the emergency room. I happened to see her for a visit at our clinic. And, I could literally only see her for 20 minutes, but I kind of already had an idea in my head what muscle groups could be causing the problem, because there are certain muscle groups that are located kind of deep in the abdominal area that also hook up onto the hip. Because remember, she's doing a lot of cycling, she's doing a lot of running. So I'm thinking hip, lower abdominal, hip, lower abdominal. And so I ended up checking out these muscle groups, and lo and behold, there was her pain. We were able to reproduce it by touching the muscle. And so we treated it literally for 20 minutes. I told her, I said, give me a call the next day. Tell me how you're feeling. She's like, this is unbelievable. The next day, she's like, my pain is completely gone. She goes, Hina, I couldn't even get out of bed this morning. That's how bad the pain was after working out the other day. And so just to kind of, reiterate to you guys, if you have this kind of ovarian type pain that feels like, oh my gosh, it's so bad that I feel like I have to go to the emergency room, this may not actually be a cyst. Now, of course, you have to get these things checked out. But let's say if you get these things checked out, you're kind of told like, it could be this. We're not really sure. Pay attention to it. But you're noticing that this is actually coming after activity. Then a big part of this could be a muscle issue. So just think about that. The musculoskeletal system, muscles within the body can cause such severe pain that you feel like you have to go to the ER, and they can even mimic things that don't even seem like they're musculoskeletal related. So if any of you guys are having this type of discomfort or pain, if you live in and around this area, then no brainer, come see us, rebalancept.com. All of our information is in the box below. But also, if you don't live in and around this area, we do consults all the time. So our consultation link is also in the description below. And if this video was helpful to you, like it and subscribe. And I hope it was helpful to you guys. So have a wonderful day.